Good day, everyone. Thank you for joining us live virtual open day from Masa University. Please like and share this live. Also follow our Facebook and Instagram page for update of further events. So, the high quality of medical care we enjoy today is built upon years of efforts by physician scientists, PhDs, and other medical professionals investigating causes and potential treatments of diseases. The tireless effort of these professionals has made many once life-threatening disease and condition just a memory. However, this is still much work to be done. Insight provided by medical research today promise to lessen the impact of our greatest health problems, including diabetes, cancer, and heart diseases. As science continues to unravel the molecular workings that underpins disease, we will see profound changes in approach to treatments. Today, we are going to discuss about importance of research in medical sciences. Before we go further into this, let me introduce our professional panelists. Associate Professor Dr. Sanin, an Associate Professor in the Department of Community Medicine, Masa University, also a public health physician. And the other hand, we have Associate Professor Dr. Chin Jin Han, an Associate Professor, also the Head Division of Biochemistry and Infectious Disease. So let's proceed to the first question. What is the purpose of medical research and its importance?
Okay, first of all, I'd like to thank Mr. Tan for the introductions, and also thanks to the Masa University for giving us the opportunity to talk about this topic on this morning. Okay, so in order to begin with the first questions about the important or purposes of research, so I would like to start to talk about what is research first. Okay, so the research can come in many forms or many types. Okay, so you can come like in the basic research, applied research, qualitative research, and quantitative research, and so on. So when you look at the definition of the research, there are many different definitions, but they are sharing some similarities. For example, if you look at the OECD definitions, it's mentioned that it should be the creative and systematic methods that undertake to create or to increase the stock of knowledge. So when you look at these definitions, you will see there are two important keywords. Number one is on the systematic. They talk about the systematic, and also they talk about the knowledge. Okay, so the knowledge could be the new knowledge or could be the enhancing knowledge in the field, within the field. So when we talk about the research, what we need to focus on is that we must have a clear research questions. Okay, so what you want to do for the research, you must have a specific research questions, and then you need to have the hypothesis. Okay, that is the testable for the two variables, and then later you need to have a systematic way in data collections, and then later you have to have a systematic way to analyze the data until you come with a new conclusion to answer the research questions. So if you look at this point of view, then you should understand what is the main purpose of research. So the purpose of the research are mainly on the like exploratory, descriptive, and the explanatory. So it means that it can be the new knowledge to the new problems or the cases that has not been reported before. Or you can be also like the descriptive purpose. You can just add on, enhance the knowledge from the past, expansion from the research in the past. And also it can be lastly in the explanatory to talk about the impact of the research questions on the existing system or the procedures. So these are the main purposes of doing research in the medical field. And now I'd like to say why they are so important to the medical research in the medical sciences. Okay, you can see nowadays there are so many new diseases and the cases. So when you do the research, we will look into the a new understanding about the disease. And then from that, we hope that we can propose a new treatments, okay, new preventive measurements, and also it's very important to do the research and share the information with the public so that we can create the public awareness. Okay, so I think research in the medical fields are very important, especially nowadays people are so busy with many other things. Okay, so we need to take care of our health and also we must know how to promote health. Okay, so that is my explanation to the first question asked by Mr. Khan.
Thank you, Prof. And what about you, Dato? Do you have anything to add on?
In public health, we have research related to more towards the public to find out what are their ways of how they live, their activities, and how this can be utilized for development of prevention of diseases. In life, as you grow older, you tend to get chronic diseases towards the end of your life. And developed countries have a lot of elderly population, and we are also going in that line. So research is necessary to find out how to keep a person healthy. And now the movement is more towards keeping people healthy longer in their life and not just adding years to life, but life to years. So what we have to do is research is necessary to find out the activities or what activities are carried out by people which can be improved on. Certain things we can't change. For example, age. Every year you have to get older. The other things are factors or risk factors that are modifiable. For example, lack of exercise. You can always start exercising, but that also needs to be, you have to be screened before you start exercising. So these kind of needs have to be only created by carrying out research. So research will give you new ways of looking at things, and at the same time you can think of new ideas and new ways of prolonging life and preventing disease. And this is the reason why in our place we do have research incorporated into our master's program in public health. We have a master's program of 1.5 years, where research is given an importance of having to do a research within 6 to 7 months, and a person can only qualify when they present their findings, and where necessary, they have to publish the findings so that their findings can be utilized by other people too. Mr. Tan?
Oh, thank you, Dato. And moving on to the next question, what qualification do you need to be a researcher?
Okay, so as I mentioned just now, we talk about the whole process for the scientific research in the medical science. Okay, you need a lot of the trainings and skill. Okay, so the what qualification do you need? I think it's important for our undergraduate students. Okay, so you will learn all these skills and also the knowledge from the undergraduate program. Okay, so you will learn about the general things that you need to know when you want to conduct research. For example, in our MBBS program, okay, you will have the module they call like statistics, biostatistics. Okay, so from there they will learn how to analyze the data, and then from some of the basic pre-clinical phase 1 curriculum, you will have some modules come with the practicals. So when they come to the practicals or the web practicals, they will have the opportunity to learn how to handle certain instruments. For example, like in the biochemistry, you will learn how to handle some basic analytical instrument. So I believe this skill is very important for the student if they want to carry out the research in future. Okay, and also they will learn about the other method, for example, how to write the research questions, hypothesis. Also, there is also one of the modules in the year 2 MBBS program. So that will be the general skill that will learn in the undergraduate or the bachelor programs. So let's say when they move on to the higher level, when we have the master program at the moment offered by the Faculty of Medicine, Bioscience and Nursing. So we have the master in public health, and then we have a master of medical science anatomy, as well as a master of medical science in mixed mode. So when you come to the master level, we will give the student will do a specific research within the field. Okay, so when you talk about the qualifications, I think these are the basic qualifications that need for each researcher, but we are not limited to tertiary education. Actually, research can be from everybody. Okay, as long as you have the curiosity, as long as you have the urge to know how to solve a certain problem, all people can be the researcher. But when you talk about the scientific research, because that is involved the systematic work to be carried out in the research, you need to have a proper trainings by the qualified staff. Okay, so that you can become a competent researcher. Okay, so that is my opinion for your questions.
Thank you, questions. And next question: does research mandatory for medical students, and why?
Okay, so you see, like this research, okay, is one of the mode of delivery, okay, other than the conventional methods such as lectures, tutorial, okay, discussion. So this is the outside classroom activities, okay. So when they do the research, at least the student, number one, they will learn how to write a proposal. They will learn how to carry out the research with a proper manner, and also they will learn how to work in a team if the research is being conducted in a group. So from there, they learn how to communicate and how to work in a team. So the teamwork nowadays in the medical profession is very important. So in future, when they're working in the hospital, okay, they are not working alone. You have to work with a team consisting of the healthcare profession from different areas, such as from pharmacies, nursing, and so on. Okay, so I think this is not the research is very important. Okay, for the students in order to be the competent medical doctors in the future.
So, the last but not least, what is the future of medical science? As a public health physician, what is your view? The future of medical science.
Okay, medical science has developed a lot. We talk about medical science now and 50 years ago. Now there's no need for the stethoscope. Okay, we are going to an age where the stethoscope has become not relevant anymore because there are better equipment around now. And the man is hooked onto the machine and you tend to find out what disease he has without touching the patient. So patient care seems to be going on the way back. And it's more, we are also getting into long distance medical treatment where you can go on your handphone and explain your situation, take a photograph of yourself and send it to the person. I got a skin disease like this, and you can take a photograph and send it to the specialist, and he can give you the advice, medical advice. So the future is very open, but basically medical treatment will still be there. But since we are going on healthy lifestyle, the need for hospitals should reduce. There will be more people who will be healthy. They'll take care of their own health. Earlier, the health of the people were left in the hands of the doctor, where the doctor decided what to do. In future, there will be the patient going to the doctor telling, I have all these symptoms and I think I have this disease. And I think this is the treatment because the knowledge is available to one very close to their pocket. The handphone is there. Uncle Google, you can take a lot of facts from there, right or wrong, we don't know. But with all these facts, they will be seeing the doctor. So the doctor has to keep in touch with the current things that are going around them. For example, now we are talking about COVID-19, right? There's a lot of vaccines coming out. and there's a lot of pros and cons. There are messages that are coming, telling it's good, bad. Some says you have to keep it frozen all the way. Some vaccine no need to keep it frozen. So there are different types of vaccine. Which one are you going to use? Are you going to be, because the decision should be yours, not the doctor or the government telling you vaccinate. So you have to have your own knowledge. Nowadays, the health or management of health in a person is in the hands of the person himself. Previously, it used to be the doctor who knows everything in brackets, and the patient just follows because they trust the patient. The doctor is know all doctor. But nowadays, since knowledge is freely available, patients are more knowledgeable, but not maybe not wise, but knowledgeable. So these are things that are going to change. The way we handle patients, our patients handle themselves. In future, medical science, most of the lab tests may be able to be done at home. You can use any part of your body, urine or blood or whatever. A fingerprint may be enough to give you the results of 20 tests or something like that. Instead of you having to go to clinic. For example, now pregnancy tests can be done at home. Before, you have to wait for you to start missing a period and having vomiting and then go and see a doctor to confirm. So certain things like that, even HIV testing can be done at home. So most of the things will now fall back on the human being himself. The patient himself will become a diagnostic doctor and may want to do different way of management. He may not want to follow the advice given by the doctor. So he might want a second, third opinion. So these are things that we have to look forward to. Medical science will improve to a stage where we can't think now. For example, we couldn't have thought about flying robots and people with robotic things and all even 30 years ago. So if you ask me like 30 years ago, I wouldn't be telling you what's happening now. So in future, the rapid change is there, and it's anybody's what is going to be like. But some of the changes are the patient or the person himself will be taking charge of his or her own health. Thank you.
Thank you, Dato'. Prof. Chin, do you have something?
Yeah, so I mean, just to add on to what Dato' has said just now, I think the future of the medical science depends on you. Okay, so let's say when you talk about the research, when you talk about the futures research or the researcher is a lifelong learning process. Okay, through the research, you can make sure that you are relevant and up-to-date knowledge, and to make sure that you are being close to the new development within the field. So by doing so, you can always make sure you learn, and you learn. So we should not stop learning. For example, after your MBBS, after your master, and after your PhD, it doesn't mean that you can stop learning. So the learning process is still going on until the last day. So you need to get involved in research, be an active researcher, work in a team, come up with new ideas to solve the problem for the people. So what I want to say at the last, for the medical science, when you do the research, always remember about the research ethics and the professionalism. So you should do something that is useful and valuable to solve the issue and the problem facing by the people, or especially patients. And make sure you disseminate the information and share with the community. Okay, so thank you.
Thank you, Prof. Chin. So I think that is the end of our session for today. So please stay tuned for the next segment. So and thank you, Masa University, for giving us a chance to give this talk. And thank you, Dr. Senan, and also Prof. Chin. Thank you for attending this discussion. Thank you.